came in and I said, I don't care what happens. I'm going to a meeting every day.
Yeah.
And I said, I'm not scared of a germ. You know, I used to snort cocaine off of toilet seats. And I know this disease will kill me.
I'm a sign.
What the hell?
What? I'm Dr. Ida Brown.
I'm Dr. Sonia Sloan.
And we are AYA,
Black and Brown Women Disruptors in Healthcare and Beyond. Okay, so aside from snorting cocaine off toilet seats, we're going to talk about measles today. And so, yes, the highly contagious childhood disease that we've been talking about since last year, you guys, when RFK Jr. took office, right? And the numbers have now exploded. And so while the United States officially eliminated measles in 2000, 25 years ago, the status is now serious. It's at a serious risk for losing that status in April of this year. So due to the continued rise of measles cases, as well as HHS's secretary's negligence under the Trump administration, the elimination does not mean zero cases. So just because we say, elimination is the status, you do still have cases. But what they're saying is no sustained person-to-person transmission for 12 months. And so over 2 decades, the United States maintained that benchmark. But January last year, the outbreaks resurfaced and the new cases are being reported across multiple states. So if the transmission continues at this pace, the country is going to lose its elimination designation, a reversal that infectious disease experts are calling deeply concerning. Dr. Aaron Glatt, the chief of infectious disease at Mount Sinai, South Nassau, described possibly that this is a very sad commentary at this time in history that current public attitudes towards health. So emphasizing that measles is not just a serious disease, it's serious enough and capable of causing severe complications and even death amongst children and adults. So Dr. Brown, these are things that we could have prevented, right? Outcomes that didn't have to happen.
So how is elimination actually maintained? So public health experts are clear. Herd immunity is key. So at least 95% of a community must be vaccinated to prevent sustained spread. So at that level, even individuals who cannot be vaccinated, such as your infants or your immunocompromised patients, they remain protected, right? But researchers at Johns Hopkins have described coverage with the 95% coverage there as being robust herd immunity. So really noting that once your vaccination rates fall below 90%, that's where the risks of outbreaks really rise dramatically. So again, 95% coverage is robust, below 90% is a risk of outbreaks. So in short, elimination is not automatic. It's maintained through consistent high vaccination coverage. And when that coverage slips, measles returns. So as of today, the Center for Disease Control and Prevention shows there are 996 confirmed cases of measles in the United States in 2026. And right, that might not sound like such a large number, but let's put it in context. In 2025, the entire year, we had 2,280 cases. So right now, we're already on track to exceed that. So in some states, the problem is that these numbers are huge. So South Carolina alone has reported over 950 cases. And the problem is that most of those people were not vaccinated. And if we look at this graph, you can see that who's being hit? 436 cases are in children aged 5 to 11. 253 cases are in children aged 0 to 4. And then 179 cases are in kids aged 12 to 17. And just let that sit for a second. The majority of these cases are children. And it's not adults, it's not your seniors, it's kids, actual children. And that's the very population that these vaccines were designed to protect. So what we're doing is we're actually watching preventable disease concentrate in the youngest among us. And in other states, like Illinois, for example, they just confirmed its first 2026 case with potential exposure at a church service. And in Texas Hill Country, There are confirmed cases that have been clustered in families. And really, the bottom line is that measles is not contained. It's definitely not eliminated. And it's growing. It's growing. And so why is this serious? Because measles isn't some seasonal sniffle. It's one of the most contagious viruses known to mankind. If someone infected enters a room, the virus actually lingers in the air in that room for up to 2 hours. So that means you could walk in later and still get infected 2 hours after someone with measles left. That's crazy. So that's how contagious measles is. And that is exactly why herd immunity matters, right? It's so incredibly important because we can't depend on places being clear, right, of measles. We depend on community protection to keep those levels low. So just take a look at this. Let's roll this next clip.
Let's take a look at how it spreads. This person here is infected with a disease. In a population with no immunity, they can infect 12 to 18 others. Those 12 to 18 people can then infect another 12 to 18 people each. That's much more contagious than diseases like chickenpox or COVID-19.
I mean, that is a great graphic that Reuters put out, and it really shows how contagious this disease really is. You can infect up to 18 people if you're unvaccinated. 12 to 18 is what they said, but it's a super spreader. Measles is a super spreader, more than chickenpox and definitely more than COVID-19 was. And it's not just the rash or the fever that people get, it's the complications that really can harm a baby, a child, an adult. So you get complications like pneumonia, encephalitis, which is swelling on the brain, which can also cause death. Hospitalizations, that's medical bills. You can also get more sick in a hospital, as Dr. Brown and I know. Long-term disability, what happens with complications, and even death in a small percentage of these cases. So let's be clear. We may have eliminated an endemic case of measles in 2000, and now 25 years later, it's come back with rip-roaring a vengeance. The recipe for